The Prioritising Protection report does cover a lot of ground and looks across what operational panels are doing to provide a multi-agency response to extrafamilial harm and the strategic activity that sits above those panels. But we do highlight some thematic findings across the study. Those include the fact that at the moment, these processes straddle both children's services safeguarding and criminal justice and community safety pathways. And that creates an inconsistency in how panels are used, who oversees them, how risk and need is measured in them, and so on and so forth. Panels in particular also focus heavily on information sharing as a key function of what they do, but we found much less evidence of shared actions being agreed in the panels, including a number of the actions being agreed being to collect more information. So there's a real need to understand and support how we utilise panels towards taking action and not just to sharing information. This is particularly important because a number of areas that participated in the study, including 5 out of the 6 case study sites, identified elements of disproportionality in terms of the children and young people being discussed at those panels. And what we really found was a struggle across all participating sites and in national interview participants to talk about racism and to move beyond talking about and monitoring disproportionality and towards thinking about how you use multi-agency panels, planning processes to actively address the disproportionate impact, not just of violence, but of service responses to children and young people. We also identified that these panels are far less likely to be used for serious youth violence, harmful sexual behaviour and abuse in young people's intimate relationships than it was for responses to sexual and criminal exploitation, creating a further gap in available protections for children identified for some harms and not for others. And really, the workforce responding to these issues are under immense pressure, and often panels are utilised to contain a lot of that pressure and provide support. But there's a real need for far more nuanced and sophisticated support for practitioners who are operating in the space so that we can move panels on to be thinking more strategically and thematically and less to contain professional worry, where we need clinical supervision and appropriate staff support mechanisms to achieve that function for our workforce.